Dear viewers, it gives me great pleasure to represent the Supreme Committee on this 29th press conference in regards to COVID-19. And let me start by saying, unfortunately, the pandemic is still here. COVID-19 disease is still here. We thought when Omicron started that this might be the beginning of the end. Unfortunately, there are subgroups of Omicron now which started spreading in countries where they reach an excellent level of vaccination. Admission rates started to go up as well. Let me go over some figures first, and then I'll elaborate more about what we are doing in Oman regarding this virus and this pandemic. Yesterday, there were 50 confirmed cases in the Sultanate of Oman. Unfortunately, our numbers are still fluctuating 50 and above. It is almost static, which means the virus is still here. Those who were admitted yesterday to the General Ward 13 and our intensive care units 3, alhamdulillah, there were no deaths yesterday. The recovery rate, those who recovered from COVID-19, 98.6%. Let me now briefly talk about vaccination rate. Those who received at least one dose are 97% of the targeted population, and I have to stress the targeted population 12 years and above. 2 doses, the total 90%. From the Omani population, the first dose is 97% of the targeted population, the second dose 91%. But the third dose, unfortunately, only 10%. That's 160,198 Omanis only. For our colleagues, the expatriate, those who received the first dose, 97%. Those who received at least 2 doses, 89%. The third dose, 39%. That's 573,348. We've been publishing the data for the cases, admission to ICU, admission to the ward, and death. 98% of those who died of COVID-19 over the last few months were those who either received no doses at all, or 1 or 2 doses, and more than 6 months passed after the second dose, and they did not take the third dose. It's very obvious that vaccines protect from severe disease and can prevent death as well. Therefore, I'm urging everybody who's 12 and above, if they have not received the vaccine as yet, please go to the nearest health center, the nearest center for vaccination in Oman. It is free of charge for everybody, and take your first and second dose. Those who are over 50 particularly, and those with chronic diseases or low immunity, I urge them to also take the third dose. The FDA, Food and Drug Administration in the United States, yesterday approved the 4th dose for those who are over 50 and they have risk factors for severe disease. The European Union, in their regulation, that if 270 days, i.e. 9 months, passed after your last dose of the vaccine, you will not be allowed to enter the European Union countries, whether for business or holiday. So I cannot stress enough the importance of vaccination to reduce the impact of the disease and reduce the death rate from COVID-19. I honestly still don't know why those 10% who have not received a single dose of the vaccine, what are they waiting for? I don't know. Are they still listening to the rumors, which proven to be wrong? Let me remind you of one of the rumors which came initially when we started vaccinating worldwide, that those of us who received the vaccine, they will be dead after 2 years. I've received the vaccine in November 2020. So that's 2 years now and almost 4 months. I think I'm still alive, and nothing happened to me. These vaccines are safe, effective, and very important in reducing the risk of being admitted to hospital. Our healthcare system, like any healthcare system worldwide, severely impacted by this pandemic. We've been under tremendous pressure over the last 2 years and few months. I'm very grateful to the staff and healthcare, whether it's government or private sector. They've been working very hard. Yes, the numbers are less. Yes, the admission rate is less, but we've been there before. We've been there before, and unfortunately there was a rebound of the virus, with new strains, new variants, which came up and took us to square zero. We do not want to go back to that. None of you want us to go back to that. We've lost many lives already worldwide. The published figure of death from this pandemic worldwide is 6,159,111. But there was a very alarming article in one of the very reputable medical journals called The Lancet, which everybody in healthcare knows it. They believe that the number of those who died because of COVID-19 worldwide is more than 18 million. So again, I go back. What tools do we have to protect ourselves, our community from this disease? Vaccination, number one, and it's available. No excuse for anybody not to take it now. Avoiding crowded places when it's unnecessary to be there. Wearing the mask in crowded places and enclosed places. The Supreme Committee already, with several meetings, and we are always actually in meetings, they said now the mask only indoors, and I'm in full support of that. But you don't know who is walking next to you inside a shopping mall or wherever closed places. You don't know whether they are carrying this virus or one of, unfortunately, as yet unknown strains. Therefore, to protect your family, your community, you need to do minimum things. The vaccination, number one. Mask, number two. Hand hygiene, number three. Avoiding crowded places. We've seen in countries where they relaxed most of these public health measures, the numbers went up in a very, very alarming way. And scientifically, it's well known that the longer a virus stays in circulation in any community, the more likely that there will be new strains, new variants. And unfortunately, it's not always the new variants are weaker than the previous one. The world has been very lucky with Omicron variant. The way it spread so fast, if it was more severe than Delta or Alpha, the death rate would have been very, very high worldwide. So yes, Omicron in a way was a blessing. And it may lead in countries where they cannot afford vaccination, in countries where unfortunately still they have not vaccinated 10 or 15% of their population. It may lead to community immunity, or what is used to be known as herd immunity. But let us have something that we know will protect us, and that's the vaccination which are available in Oman. The Supreme Committee took some decisions regarding the current situation, and for those who our brothers Muslims who don't speak Arabic, of course there are some relaxation, going to mosque and performing Salat Taraweeh, but with some precautions. And I think being sensible, if you have any symptom of respiratory disease, i.e. coughing, sneezing, sore throat, fever, please do not go to crowded places, whether it's mosques, shopping malls, or elsewhere. I hope we'll see the end of this, but it's not here yet. It is not here yet. The virus is still there. I think you are following what's happening in many countries, west and east, and in certain countries the numbers are alarming. Before I end and switch back to Arabic, I would like to thank all the journalists for being partners since this pandemic started. They've been partners with us in healthcare, like many other partners, to combat the impact of this pandemic, to spread the accurate information from the accurate sources. Misinformation and disinformation, unfortunately, now used in everything, including healthcare. And one of them are the anti-vaccine misinformation. And those who still, unfortunately, deny that this virus ever existed. If the Lancet report is accurate, and I don't doubt that journal, 18 million people lost their life because of this virus. 18 million people. Also, we need to remind people that, unfortunately, luckily, the majority of people who had COVID-19 recovered fully, but there is a large proportion still who have what's called long COVID, i.e. symptoms persist for months and maybe years after COVID. And fatigue is one of the common symptoms, shortness of breath. One of my colleagues who had COVID-19 is a doctor. He's in his 60s, and we had a farewell party for him. He had it over a year now. He is still suffering from shortness of breath, muscle pains and aches, and weakness. So why do we expose ourselves to something that we can prevent? It's not 100% proof that will prevent it, but vaccines will prevent you from having severe disease and prevent death as well. 98%, as I said, of those who died from COVID in Oman over the last few months, they either had no vaccine whatsoever, or 1 dose, or 2 doses only, and no 3rd dose. So please, look after yourself, look after your families, protect them, protect our community from COVID-19, and I wish you all well. Thank you very much.